Hello, if you are here to attend the overdose education and naloxone distribution training, you are in the right place. This workshop is for 1 hour. It's an intensive and it has the COVID-19 safety measures already integrated. If you've attended this training anytime up to the first or second week of March, a lot of it is going to feel like review, but we are going to update you with the new safety measures. I'm going to ask you, please stay on mute for the duration or for most of this workshop. I'll cover the material, and then at the end, we will have time for questions and answers, and you could lift your mute and ask me direct. You're also welcome to put your question into the chat box. So this 1 hour intensive, we're going to cover the information that will be useful to you to prevent, recognize, and respond to an opioid-related overdose. And then we're gonna give enough information so you feel like you could use that Narcan or Naloxone after this training. Everyone is going to be getting their own kit of Naloxone. So after this workshop, someone will be dropping off the Naloxone. So if you've attended the training, you'll get your own kit. We would like to thank the New York State Health Department. Some of our original COVID-19 safety materials are inside this content. We would like to thank our cousins in Oakland, California in harm reduction for sharing the idea of putting a Narcan box on the wall. And I'll be talking more about this during the training. And we would like to thank you, frontline workers, for going to work. And thank you for your service. So this is a partnership. My name is Joanna Burton Martinez, and I work with Los Angeles County, the Office of Diversion and Reentry. I work alongside with members with the Community Health Project Los Angeles. CHPLA has been around more than 25 years. They started with needle exchange. They help move Narcan forward, and we work together giving these trainings, and we could also answer questions and help with some TA or programmatic problem solving after the call. A short PSA gentle reminder during coronavirus, please wash your hands before and after everything. Please stand 6 feet from just about everybody. And please cover your mouth, cover your face. Now, the overdose education program has been in effect before the coronavirus hit, yes. And in part because Los Angeles County has been experiencing an increase or an uptick in accidental death led by accidental overdose. Now, a lot of programs in the US are sharing overdose education and giving out the Naloxone, and what just keeps coming back is lay responders have the ability to respond or reverse an overdose. Overwhelming. So I just want to reassure folks on the call that you don't need medical training and you don't have to have gone to nursing school in order to use the Narcan and help reverse an overdose. We also share this information because, we care. Just because somebody has a problematic or habitual chaotic drug behavior does not mean we don't fight for their life. The agenda today is pretty simple. The first half, I'll talk about how to prevent overdose. And then in the second half, about the actual response and protocols. So by the end of this training, or at the top of the hour, you will feel pretty comfortable that you will be able to call 911 and use Narcan in the event of an overdose. And you will be able to show or instruct someone else how to dial 911 and use the Narcan if there was an overdose. You will also be able to tell folks where to find that Narcan. Everything we're doing is perfectly legal. There is a Good Sam law in California, and this will offer a certain amount of protection for more low-level drug offense like personal use amount of drug or some paraphernalia. So if someone is at the scene of an overdose and they've got a small amount of drug on their person, the ask is please stay and help the person in their overdose. You aren't going to get busted for that small amount of drug. Now, Good Samaritan law does not cover the bigger stuff, acts of violence, weapons, anything that would involve child protection services, outstanding warrants. The law on the right, the Liability Act, Governor Brown signed that in about 6 years ago, and that is actually what we're doing right now. You see, this Narcan, the Naloxone, it is a prescription medication. But instead of having one prescriber fill out a whole bunch of scripts individually, they put this thing in place called standing orders. So in Los Angeles County, we have a medical director who is actually our one prescriber. And the agreement is we would share the information, what is Narcan, how to use it properly, overdose education. So after this conversation, it is perfectly fine for us to give you the Narcan. If you have a conversation with a client and you share with them what you learned today, or if you want to show them the 4-minute video, I could also send out after this email. It is fine to show a 4-minute video that we have that is compliant and then to give them the Narcan so they can use. Goodness. So that is what's going to be in front of us. I'm going to now just kind of focus on the overdose prevention aspect. In truth, someone could overdose on just about anything. This is about drug overdose and opioid overdose in particular. With drug overdose, the definition is either the overdose occurred because of too much of one drug, or that drug was too strong, or there were too many drugs. All right, so it's either overwhelming by one drug or too many drugs, and it's just too much for the person's system. Now with opioids, opioids are a drug or a substance. They can be made synthetically or naturally. Now opioid use does affect the central nervous system, and it slows down the person's breathing. So opioid use could slow down the person's breathing. And I'm bringing this up now because I'll bring it up again when we talk about how to respond to overdose. Opioids could be turned into a liquid solution and injected. They could be in pill form and swallowed. Tar substance that's smoked, or in another region, a powder that's chopped up or snorted. Now, all these different ways to consume the drug could be habit forming, and all these forms could accidentally lead into an overdose. Other samples or examples of opioids would be like codeine, methadone, morphine, Percocet, Vicodin, and fentanyl is in red. We wanted that to stand out. Fentanyl is an opioid. It's a very powerful one. Some say up to 50 times stronger than heroin. And so Narcan works on opioids. Fentanyl is an opioid. So Narcan should work on fentanyl. You might need more of it, and I'll talk you through that. But we are going to give you some information that we also have on fentanyl. So I'll describe a little about what happens during that opioid overdose. The person slowly stops breathing. Until the breathing stops, the lack of oxygen could affect the brain, the heart will stop, and then it could lead to a fatal episode or a death. So in response, we're trying to catch them in the upper tier. In a heroin-related overdose, this process could take 1 to 3 hours from the beginning of someone slowly stop breathing to stopping. In a fentanyl-related one, this could take minutes. So this process could happen pretty quick. I'll give you the signs of an overdose. And what I mean is like what you would be looking at. I probably clocked about 15 responses in my time. And the first stretch did happen at work, you guys. But more than half now have happened in public when I was on my own time. So the scenarios I'll describe, it may happen on shift if you respond to overdose, but you could be on your own somewhere totally else. You just happen to have the Narcan on your person. I guess my point is, do not try to outguess what that other person took. I'll tell you what the signs of overdose look like, and if 1, 2, or 3 of these are happening, then you would respond. For example, they're breathing. If someone's slowly or shallowly or not breathing at all, that would be a sign. Conversely, if they've got that gurgle sound, it's like the body's fighting to breathe. That's not regular breath. So someone's breathing, not having any at all, or something really gargly, that could be a sign for overdose. Another sign could be the discoloration of mouth and fingertips. With the lack of oxygen, their mouth and their fingertips are around the fingernail beds. They could turn blue, dark purple, a sign or an ashen gray. Another sign for opioid response, another sign for opioid overdose is that they have no response. That person isn't responsive. So anything you say or do, they aren't going to respond back. They're unconscious. Now, someone could be have one, two, or all three of these signs. So those were opioid overdose in general. We have heard some more information on what a fentanyl-related overdose could look like. So in addition, one thing was described was called a wooden chest. Like after the person used the opioid, bam, their chest would pop out like, poof, and it goes straight, hard as wood. This could happen in the lying down position. And so because it's so tough and the wooden chest. Another sign has been described almost like a tight shake or a standing seizure. And this could be standing up or in the upright position. And the last thing to may indicate for a fentanyl-related overdose is this one gal described, she's like, as someone is slowly tipping down, their hands will be going up. So they'll be bent at the arm and the elbow. So it would go bent at the wrist and the elbow, almost like T-Rex. I don't know what's going on with that, but I do know if you saw someone going like that or sitting in that position, then you could go see, hey, are those other signs of overdose occurring? About Narcan. Narcan is naloxone. Naloxone is Narcan. And so in every kit, there's going to be 2 doses. All right. So yeah, Narcan will reverse or block the effects of the opioid. Calling it a safe medication, you can't get high on Narcan. You can't overdose on Narcan. There's no allergic reaction to Narcan. Leave it out of extreme heat, extreme cold. Leave it out of the sunlight. But I do think if you grab your kit and you threw one of your doses in your bag, you'll be fine. So this is a view inside of your brain, and this is how the naloxone works. You see, when someone gets Narcan, it's not like you aren't flushing the drugs out of the system. The drugs stay in the system. So on that left-hand side, those little green screws, that's the receptor to your brain. When someone takes the opioid, that yellow-green ball, it makes a connection, all right? Now the person is gonna feel the effects of the opioid. On the right-hand side of the screen, that orange ball, when someone gets Narcan, Narcan comes in, it kicks off the opioid, and it takes its seat. Narcan hangs out on that seat for about 30 to 90 minutes. And the entire time, opioid is in the wings. All right. Narcan wears off 30 to 90 minutes later. And when the opioids could jump back on the receptor. All right. So that's why we tell folks, if you were just Narcan, don't take more opioids. Not only are you not going to feel it, but when the Narcan wears off, those opioids may take a seat, and that could lead to an accidental overdose again. Okay, so true to this, opioids only can be reversed by the Narcan, okay? So Narcan only works on opioids. So if someone was taking a lot of powder cocaine, for example, and they're taking a lot and they're about to overdose or overramp, if somebody Narcaned them, the Narcan will not reverse the effects of a stimulant-related overdose. No, that's true. However, because fentanyl has been popping up in different drug supplies, We're telling anyone, if you are unsure, please use the Narcan. So technically, no, Narcan will not work on Valium, benzos, cocaine, Adderall. But we've been hearing from enough people who have tried to buy Molly or ecstasy or methamphetamine or a pressed pill sold as Xanax, and they were able to overdose because there was unintentional fentanyl use. Does that make sense? So if we used to tell anyone who used heroin or an opioid, carry Narcan, now we're telling everyone who uses any drug, carry Narcan. And so that's the rule of thumb. If someone's showing signs of an overdose and you're unsure what they took, just use that Narcan. It's a safe enough medication. I'll talk through a few of the risk factors for overdose. There's going to be a few factors that increase the risk for overdose. And then after this slide, I will share some tips or ideas you can have with clients about how to help mitigate or reduce these risks. So the first one, or perhaps the leading one, is there's a greater chance for overdose after someone starts using after a period of abstinence, right? A period of abstinence is basically when someone's not using. Now, when someone hasn't used or that period of abstinence, their tolerance changes. When they're having their habitual or regular drug use, their body may acclimate to a certain amount of drug. When they don't use for a while, their tolerance will change. And that's why there's a greater chance for overdose. Someone's tolerance can change in weeks and months, absolutely. But also this can happen over 3 or 4 days. So for example, if somebody tried to quit on their own on a Friday, and then they resumed use on Tuesday, that would actually be enough time to change their tolerance and increase the risk for overdose. So we tell anyone who just got out of jail, who just got out of rehab, who hasn't used in a while, and they're fixing to resume, it's that window of time when there's a greater likelihood for overdose. Mixing drugs, mixing drugs increases chance for overdose. Some people do mix drugs on purpose, so they're trying to achieve a certain effect, but we have ideas to help reduce the chance for overdose if they are mixing. Fentanyl in the drug supply is a risk factor for overdose. So whether the person knew there was fentanyl or had no idea, and the fentanyl being so powerful. Using alone in of itself doesn't increase your chance for overdose. Using alone actually increases the chance for a fatality. The way this Narcan works is someone has to use it on another person. Yeah. If I were overdosing, I would not have what it would take to realize it, stop, go to my bag, grab the Narcan, and dose myself. Narcan doesn't work that way. It's because somebody witnessed or they discovered an overdose and they were able to apply that medication to another person. Here are some ideas. And actually, when we unmute, if you have any yourself, we would love to hear them. So the first thing anyone could do to reduce their chance for overdose, and they could start today, is they do a taste test. They try a small amount of their drug every time, and they're testing to see, is that the drug they purchased or how strong it is. All right, and so if you have a bag, you could pinch from it and do a taste test every time. Take the pill, cut it in half. So a taste test could reduce overdose to test the strength. Leave the Narcan out, make it obvious. So when folks are doing their thing, they could have like their Pepsi bottle, their ashtray, their Narcan out. This stuff works because someone saw it and were able to use it straight away. If mixing drugs, keep an eye on the benzos. Benzos affect short-term memory, and it would be totally possible to forget what drug you took or how many. If mixing drugs, use the opioid first. You use the opioid first, so if it is too strong and someone overdoses, you could reverse it with the Narcan. And then you could do that without the compounding issues of having like drink, stimulants, or alcohol involved on top of that. Let people know it is okay to Narcan you. Just tell everyone, if I am blue, if I don't wake up, put this up my nose and use it. And yes, we do ask folks, try not to use alone. People have their reasons why they do. So if that is the case, can they do the buddy system? And this could be with another resident or maybe staff. And all they're asking is, hey, can someone knock on my door and wait to hear me say, what's up? Until they bounce. So basically you're just checking in on someone on a certain time and you're just waiting to hear their voice. That's just one idea. This is a self-test for your own self. I have 3 questions. All right, so true or false? One way to reduce overdose is by using a small amount of drug every time, like a taste test. True or false? Narcan works on fentanyl. True or false? Naloxone only works on opioids, but used if unsure because it is a safe medication. Well, let's see how you did. It's true across the board. Small amount, taste your drug or test it before full issue. Narcan works on fentanyl. And even though Narcan doesn't work on opioids, use it anyway if the person looks like they overdosed because it's safe enough. All right, now we're going to do the second half of this, and this is when it's about the protocols surrounding overdose with all of the updated COVID-19 safety information. Okay, so to begin with, if there was an overdose, the only 2 things you have to do, use the Narcan, dial 911, okay? If there's an overdose and the only 2 things you do is use the Narcan and dial 911, you're good. So there is a rule of thumb. And the rule is whatever you have in your hand first. So if you got your phone out, you dial 911 and you find the Narcan. If you got your Narcan ready, you use that first and then go find your phone and dial 911. So both answers are correct. All right, so the overdose. In order to know if it's an overdose, you got to assess. And when people are in the seated position, typically in the overdose, they're going to start falling forward. And so you may see on the bus if someone is falling forward, or maybe their forehead is on their knees. Someone also could fall forward and kind of flip over. So I've seen people on the ground that they weren't sleeping in fetal. It was like they kind of fell and got twisted. So on first look, maybe the person who was sitting there hasn't changed position for a while. Or maybe they were twisted up on the ground and something didn't feel right. They weren't sleeping. Or maybe their forehead was just about pressed on their knee. So the first thing you do is you try to wake them up. This is how you assess, is it an overdose? There's 2 parts to this. You use your voice and you use physical simulation. You might be by yourself, you might be with a coworker, you might be on a crowded bus with a bunch of strangers. However it goes down, you walk up to the person, say this is the person, you go straight into their ear, speak direct and loudly, start with, can you hear my voice? If you get nothing, then you could yell hello. Hello! Okay. If someone was just nodding out or experiencing the drug, or if they were taking a nap, that's going to wake them up right quick, talking loud or yelling. Now, if the person is deaf or hard of hearing, that might be another reason why they don't respond. After you try with your voice, you try with the physical. Okay, so if you get nothing doing the voice check, then you try to do a stimulation. In that picture, that's called a sternum rub. You put your hand in a fist, you use the knuckles, you put them on the breastplate, and you bore down. You just have at it. If someone's nodding out or snoozing, that's going to wake them up. Depending how the body fell, you may not have access to all parts. So you could try a sternal rub, you could try pulling out their earlobe, or you could try shaking their knee. After you use your voice, after you use your physical, if they are not responding, now you are going to determine this is an overdose, or you will respond. As it's an overdose, now is the time to take action. So first, the Narcan. You can use naloxone on someone in the seated position. Responding to overdose works is a bit easier when they're on their back. Okay, so you get your kid a Narcan, you grab out a dose from the back, you peel it out, and then you get your dose of Narcan. Whoop, here we go. So you got your 2 fingers and your thumb. This is 1 dose. You go up to the person, you put it up their nose, and you push it in to give them 1 blast. There is no test shot, so please do not test shot this in the air. There's only 1 shot, and that goes in their nose, 1 blast, or when you push in the plunger. After you do that 1 dose of Narcan, you wait 2 full minutes, 120 seconds. It takes a little time for the Narcan to take, so you gotta wait a few minutes. If the person doesn't show signs of waking up, and they might blink into it, after 2 full minutes, if they don't start to wake up, you give them another dose of Narcan. You wait 2 full minutes. If they don't show signs of waking up, you give another dose. Some responses, you guys, could take 1 or 2 doses of Narcan, and some responses might need 3, 4, or 5. Either way, the script stays the same. 1 dose, and you wait 2 full minutes. So when you're calling the emergency operator, when dialing 911, they're gonna wanna keep you on the line. You just gotta tell them you found someone unconscious and give the address so the ambulance knows where to go. And if you are responding, you could always put your phone on speaker so you could use both hands and just let the operator know. Please stay cordial. They are only doing their job. They may ask you questions that you honestly have no idea, and it is okay to say, I don't know. They may ask, who is the person? What are they on? I don't know. The third component we ask of providers is please stay with the person. You stay with the person in between doses. You stay with them until they wake up, and you stay until the EMT arrives. So here is the updated COVID-19 safety protocol for that Narcan, all right? It goes like this. If you believe there is an overdose, without delay, you use the Narcan. It will take less than 2 minutes, you guys, for you to assess, is this an overdose, and to use the Narcan. Once you give the blast, you walk away 6 feet, and you wait 2 minutes. If they don't start to wake up, you walk back to the person, you give them another dose of Narcan, you walk back 6 feet, and you wait 2 minutes. And that's it. If these are the things you do after dialing 911, give a dose, walk 6 feet away, and wait. So this is the protocol, yeah? 6 feet away, wait, and then give another dose if they don't wake up. If you found the person when you were alone, or you had to leave the person alone to go get help or grab a phone, you put them in the recovery position. And this is when you put them on their side, swing their leg over like a kickstand, and then you use their hand like a pillow. Working with unconscious weight, you guys, it's pretty heavy. Even the smallest, littlest person, when they're unconscious, it takes some manipulation. So use your legs to move someone, or you could use your body to help levy theirs. We just want to be mindful that their face doesn't accidentally hit that sidewalk when we're putting them in a position. I'm going to spend a little time on this rescue breathing. If you got our workshop up to that 1st or 2nd week of March, we made a big impression on this. If an opioid-related overdose, someone is slowly not breathing, the best thing you could do is give them oxygen in between those 2 minutes for a Narcan dose. Okay, so here's the update. No one on this call is mandated to rescue breathe, okay? You are not mandated to rescue breathe. There is a risk of COVID-19 infection from traditional rescue breathing. So if this was the person who overdosed, we used to say, if you're giving someone breaths, put your mouth on theirs. There is going to be a risk for coronavirus transmission. We gave out these little things, right? If you were an outreach worker and you use a light, thin mouth shield, For rescue breathing, there is still going to be risk for COVID transmission. If all you did was dial 911 and use the Narcan, you are perfectly fine, okay? I'm going to talk you through a few risk reduction ideas surrounding rescue breathing. For COVID-19 safety, the ideas or suggestions involve masks. That one in the blue, it can go around your head. It blows in one direction, and then you could use your hands. You could hold on to this, disinfect it. The one on that right, it's the ambu bag. And this acts as the person breathing for them, right? So you take the bag, secure the nose and mouth, and you give them a breath. In COVID safety, the person in the photo would be wearing gloves and a face mask while they were doing this for 2 minutes. So rescue breathing, it's one breath for every 5 seconds. If you were using the bag, it would go something like this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. The body has a rhythm. 1 to 5 is the rhythm. What doesn't help is going really fast and just making it, force it in there. Try to keep the 1 to 5. Now, if clients ask you about their traditional form of rescue breathing, I'd like to let you know what we were telling people. You see, if someone knew the person, or like say they were really close, or let's say they both got tested and they came out negative, and one person knows the other one who overdosed is at no transmission risk. However you do, if there was a traditional form of rescue breathing happening, you have to put the person on their back. You crook up their neck, you kind of like tilt up their chin. And first, you just pinch their nose and you give 2 quick breaths to clear the airway. And then you do the 1 to 5. Just this time, you're the breath. You pull in all your air, you pinch the person's nose, secure your mouth with theirs, and blow it all out. And that would be your 1. 2, 3, 4, 5. Pinch their nose, breathe all your air into theirs, and that's 1. You still wait 2 minutes in between each dose of Narcan. Maybe after the first dose, you could ask folks to give you a hand if they can go grab the ambu bag or some gloves, if there's a face mask, and then kind of gear up in between the 2 doses. There might be some COVID screening. What's becoming more normal now is the emergency operator or maybe the EMT, when they come on site, they may ask a few questions about COVID signs and symptoms. Please answer their questions. You may have to answer them over and over again, and stay cordial if you would. They are only doing their job. Okay, so everything on this list, I do believe one person could do if they had to. So if you saw an overdose, you would be able to find the Narcan, get the phone, get that ambu bag. Now, if there is anyone else nearby, ask for their help. So this could be a coworker, or these could be total strangers, other bystanders, if you will. So can you feel comfortable telling someone, you dial 911, you go get the Narcan? There's 2 other jobs here that can come in handy. When directing the scene, you could also ask someone to call out after a full 2 minutes. After someone gets dosed, you need to know when 2 full minutes comes up. But you guys, time in this situation is a very strange concept. Like, I honestly couldn't tell you if something was 20 minutes or 2 minutes. In one response, we actually had a gal. She had her phone out, and that's all she did. And this guy, we had a Narcan 3 times. So she called out in 2-minute intervals, and that's all she did. That can come in handy. Another job you could ask someone to do is to go wait outside and wait for the ambulance, depending in where the building, how many doors or floors are involved. Post-care. So this is the moment when the person does regain consciousness. And yeah, you know, not every try to reverse an overdose is successful, right? Sometimes the person does pass on. I am going to say statistically and optimistically, this person will regain their consciousness. And when they do, if you are the provider on site, could you tell them who you are, let them know what happened, and ask if they're all right? Something like, hi, I'm Teresa. You were unconscious. We gave you 2 doses of Narcan. How you doing? You all right? Now that last bit said do not restrain if they motion to leave. Yeah, if someone is conscious enough to get up and walk away, you gotta let them get up and walk away. Under no circumstances are you to physically restrain another person who is conscious enough to get up and walk away. A little more on the post-care. After talking to folks who survived overdose or who got Narcan, I'm asking them, hey man, what would have been really helpful the moment you woke up? What was not helpful? And just, hearing across the board, the person who woke up from that overdose has no idea what's going on. They're completely described as folks felt totally disoriented, or they were embarrassed, completely confused, discombobulated, and some folks were going through a touch of withdrawal. You see, when everyone's responding to the overdose, there's a lot of activity, but the person who overdosed, they're out cold. They missed all of it. So when they come to, they're kind of blinking into a situation. What made things worse, we were told, was when people were running around, screaming, yelling. When the person who woke up was crowded, all those spaces, everyone has to back up, even before social distancing. So what would be helpful, provider, is if you could do the whole opposite. Can you tranquilize the scene, speak to the person calmly? If there was someone or something hysterical, can you get them out of the way and earshot? No one should be watching this, no looky-loos, yeah? Only the people responding are there. Everyone else backs up. And in this way, you're helping levy a very disturbing situation. There was a rumor that Narcan made people violent. Narcan doesn't make people violent. It's when they wake up to a situation and things are really hectic and anxious, they clench up and they want to bounce. So having it lighter, softer, calmer, that could really be a help. If you have another moment with the person, please remind them you have Narcan in your system. Stay away from opioids the next 1 or 2 hours. You aren't going to feel it. You're letting them know you are not going to feel that Narcan. And we also don't want them to slip into an overdose when the Narcan wears off and they have too many opioids in their body. Know when to pass the baton. If law enforcement comes up, it's perfectly fine to tell them someone was unconscious and you Narcan them. If the EMTs, when the EMTs get there, they may ask you questions or they may just go straight to the person and hop to it. So yeah, you're available to answer questions, but at this moment, you might be more useful just hanging back or staying out of the way. So when the EMT and the dust settles, please focus back on your own self and your own care, right? Responding to overdose, it's always disturbing and unexpected, and it could throw you. So if this was on shift, can you take an extra long lunch? Can you take a walk? If you did this with another coworker, maybe you can cut out, grab coffee and just hash it out. For your programming, if you want to fine tune it, wait 1 or 2 weeks later, yeah? In the moment or the days of an overdose is not the time to tell a coworker constructive criticism about their programmatic response. Talk about it as a team 1 or 2 weeks later. After an overdose, you're just trying to get back in your skin, feel right. And it's a lot like the person who just woke up from an overdose. Do not tell them straight away they need to get into rehab or drug treatment. In that moment, they aren't going to hear it. If you would like to broach methadone or Suboxone as options, perhaps waiting 1 or 2 weeks, talking with that person would be a better time for it. Okay, we got 3 true or false questions. Mutter to yourself. True or false? If there is an overdose, use the Narcan first, then find the phone, or call 911 first, then find the Narcan. True or false? It is okay to ask bystanders to help, like call 911 or get the Narcan. And true or false? After responding to something like overdose, take special good care of yourself. Absolutely. Whatever's in your hand. Use the phone, find the Narcan, use the Narcan, find the phone. It is absolutely fine to ask a stranger for help. And yeah, always take care of yourself. Now, this last bit, up to this point, we were talking about what you could do if you discovered an overdose. There may be in that moment when directing the scene, you're going to have to tell someone you don't know that you've never met before where that Narcan is and how to use it. So these are just a couple of ideas, but you actually could break it down to, first you direct the person where that Narcan is. So if your residential does have a box on the wall, you tell folks, we have Narcan box on the wall. This might be in a first aid kit. Get the Narcan from the first aid kit. Nice. You told them where to get it. If you find someone unconscious, open the Narcan, stuff the nozzle up their nose, push in the plunger, call 911. There. Now, you took an hour to get to that part. I don't know if it's that easy. It might be. If the only thing someone needs right now is to know where that Narcan is so they could use it and save a life, those few lines could be enough. If a client wants to have a longer conversation, please have it. Share with what you learned today. And I'm also going to give you a website to find a few of the videos you could also recommend to them. Now in this Narcan, you guys will all get your own kits, and we're going to make sure your boss gets a few extra kits. So if you use one, they can replace it. And then when they start to run out, they could find me. We also want to promote, you have an option. We are dropping off these plastic boxes for residential facilities. And what they do is you put it on the wall, and then if someone needed Narcan, they could just grab it. Now, this was one of the solutions we heard in a residential setting because, I don't know, maybe staff could get trained for Narcan, but then the medication would be locked behind a door, or it was in someone's backpack and they couldn't find it. So having a mutual place where everyone can find something as obvious as being told where to get it. You don't have to put Narcan on the wall. It can go on front reception, just somewhere where everyone could have access to it 24 hours a day. If a client wanted Narcan, some needle exchange habits, call ahead. And in the blue on the bottom, laodprevention.org. There is a listing of these NAP sites or naloxone access points, and they could refill Narcan. Take another look at that website because the videos I mentioned, a 4-minute, an 8-minute, and a 15-minute one, has the same information that we have today that you could share with clients. All right, then. I would like y'all to unmute yourselves. If there's any questions, please.
Hi. Thank you, Joanna. I was wondering, does the Narcan ever expire?
Right. So yes, Narcan can expire. There will be a date on your box. If you are staff and you have expired Narcan, get a hold of us and we could switch you out. If your clients are using expired Narcan, I wouldn't sweat it. This stuff works for a while. So they could be holding on to their Narcan 1, 2, 3 years after the fact, and it's still effective. So please don't take that from them. If they want to hold on to it, it's perfectly fine. And we could always make sure you could have something fresh. Thank you. Any other questions today?
I have a question.
Please. Ah, sugar, I'm not hearing it. Is it in the chat box? Mariana, can you read it out loud?
Sure. The first question in the chat box is, how many times do you Narcan someone?
Oh, how many times do you Narcan someone? Okay, if this is the actual overdose, you only give the person Narcan every 2 minutes if they don't show signs of waking up. So one dose of Narcan may do it, or 3, 4, or 5 doses. So you would just Narcan them until they woke up or until the EMT arrived. Now, another way to view this is if somebody overdosed 3 times in the last month, you would Narcan them every single time. Okay. So every time someone overdosed and you were there to do something about it, you would always respond. There's no cap for that. Did I answer your question?
Yes.
Any more?
Oh, I have a question. Is there Narcan you need a syringe for, a needle?
Mm. Yes. So what we've been talking about is intranasal, right? Because you put it up someone's nose and you push the plunger. There is also intramuscular naloxone, and there could be some in this region. So it would be liquid, maybe a baby bottle or a small vial, and you would take a syringe to pull up. Now, if this is what you had to work with, you would pull up about 2 cc's and you hit meat. So you would hit an arm or you could hit the leg. And those syringes can go through pants or some jackets, yeah? Pull up 2 cc's and just hit the arm or the thigh meat. Thank you.
Thank you.
I have a question. What about the scene in Pulp Fiction?
Ah, thank you. What about the scene in Pulp Fiction? So this movie was made about 20 years ago. Yeah, but wow, it's still, people still talk about it. In the movie, someone took a big old plunger, stabbed someone in the heart, and they woke them right up. Yeah, that is just not true. That was an act of fiction, and those were paid actors. If in the event you did have to use intramuscular, do not go anywhere near this person's heart. You just get 2 cc's and you start with the arm or the leg. If they don't wake up in 2 full minutes, you could pull another 2 cc's, and if you can remember, you alternate the arm or the leg, but not the heart. Thank you for that question.
And Joanna, I see another question on the chat. Dalida, do you want to ask it, or should I bring it up?
Oh, can you hear me?
Yes. Hello, caller.
Awesome. I wanted to ask, there was a PowerPoint that you showed that showed the signs and symptoms that you would notice when you see someone overdosing. And on the first little box, it was regarding the breathing. Now, sometimes under other health-related issues, I have seen those signs. Would you assume it's an overdose? Is it safe to Narcan, even if you don't know if it's an overdose, or could it be a different health issue?
Right. No, good question, because that could happen. I will say, when you're looking at the signs, someone not breathing, discoloration, non-responsive, that is when you actually take action. So if you weren't sure what the breathing was about, now you're going to see, hey, are they going to respond to my voice? And are they going to respond to my sternal rub? And if they are still unconscious, out cold, then you would act for the overdose. Does that make sense?
Yes.
Someone could be doing that breathing thing. It might be overdose related or it might not, but then you do the double check.
Thank you.
Well, if there wasn't anything else for that, I would like to direct you to laodprevention.org. It's got some great local resources. It's got these videos in English with Spanish captions. And it also has a current listing of where you can get more Narcan. I want to thank you for your time and thank you for your service. You all have a good day.
Thank you.
Thank you.
Thank you.
Thank you.